welcome back. You're watching Health Mantra with me, Khushbu. So, we have a very special guest from Manipal Hospitals, Dr. Sredharan. Dr. Sredharan is a surgical oncologist. Welcome to the show, doctor.
Thank you.
So, today, of course, doctor will be helping us understand cancer and to be targeted, especially colorectal cancer. But what it is, first, let's find out what exactly is a colon and a rectum and where exactly is it located?
The colon and rectum is the lowermost portion of the digestive tract. When food is taken through the mouth, it passes through the food pipe, also known as the esophagus. Then it enters the stomach. And from there, it enters into the small intestine and then into the large intestine. The large intestine is present inside the abdomen cavity. It is also called as the colon. After the colon traverses through the abdomen cavity, it enters into the pelvis or the hip bone and it forms the rectum. Then it connects to the anal canal. Okay. So when the food is digested into in the stomach and in the small intestine, it enters into the colon where the stools are formed and it is stored into the rectum before being passed out of the anus. This is the function of the colon and rectum. The cancers which arise in the colon and rectum have similar characteristics, and the treatment, there are much similarities between the two. So the treatment of colorectal cancers is considered together.
And doctor, what are the causes for the development of colorectal cancer?
There are multiple causes which are attributed to development of colon and rectal cancer. First and foremost being age. As a person ages, the chance that the risk that the person develops a colon and rectal cancer increases gradually. And the other risk factors include, suppose a person has a blood relative who has a colorectal cancer. The risk that this person develops a colorectal cancer is higher than the other person. So the other risk factors include ulcerative colitis survivor or a person who has a previous colon cancer. The risk of developing a second cancer is high. Apart from this, there are certain health style factors which can be attributed to the development of colon and rectal cancer. The first being obesity or lack of exercise, consumption of red meat, smoking and excessive intake of alcohol. Having said all these things, there are like many cases in which a cause for the development of cancer cannot be found out.
Okay. And doctor, are there any specific symptoms of colorectal cancer?
So there are multiple symptoms for colon and rectal cancer. The first and foremost being the presence of blood in the stools, and the other things being a sense of incomplete evacuation after passage of stools. And the other thing that a person needs to look out is change in bowel habit. A change in bowel habit which cannot be attributed to any other cause, such as development of a diarrhea or a constipation which persists despite having no other cause. And the other symptoms that one should be looking for is a development of a loss of weight or loss of appetite or a lethargy which cannot be attributed to any other cause. So in Western countries where there are where the incidence of colon and rectum cancer is high, there are screening procedures in screening programs in situ. Such as a person over the age of 50 years in Western countries, almost all of them get a colonoscopy done to check for the presence of cancer. In India, unfortunately, such a screening program does not exist. So any individual who has the above mentioned symptoms or who is a relative of a person who is a survivor of colon cancer should undergo a simple fecal test known as FOBT, fecal occult blood test, which tests for the presence of blood in the stools. If the FOBT test, if there is no blood in the stool, the likelihood of a person harboring a colorectal cancer is very less. Suppose the fecal occult blood test comes positive, then the person should undergo a colonoscopy test to check for the presence of cancer.
And doctor, having said that, what investigations does a person need to undergo to find out about the colorectal cancer?
The best investigation to identify a colorectal cancer is colonoscopy, which is a tube which is fitted with the camera and it is passed through the rectum of the patient into the colon and a biopsy is taken from the tumor. This confirms whether there is a cancer or not. Once a cancer is confirmed, then we should stage the patient at what stage the cancer is present. For colon cancer, the contrast enhanced CT scan of the abdomen of the thorax and abdomen is done. For rectal cancer, apart from the CT scan, an MRI of the pelvis is also done. So apart from these scans, the added blood tests are also done, such as there is a tumor marker test called CEA, which is useful after the treatment to follow up of the patient or to assess how the patient responds to the treatment. Suppose a person during this treatment is planned for surgery, certain other investigations are also done to assess the fitness of the patient for surgery.
Okay. And doctor, how do you determine the stage of this cancer?
So once the scans are done, in the colon and rectal cancer, we get a fair idea of what stage the cancer is. So broadly to classify, there are like 4 stages of cancer. Stage 1 is a localized cancer, wherein the cancer is confined within the colon or the rectum and it does not spread anywhere else. Stage 2 and stage 3 are called locally advanced cancers. The cancer has either bulky, or it is either big, or it has like infiltrated into the surrounding organs, or it has spread to the surrounding lymph nodes. This is called locally advanced cancer. Stage 4 is also known as metastatic cancer, wherein the cancer has spread from the colon and rectum into a distant organ such as lungs or liver, or sometimes it can present as a fluid collection in the abdomen. This is last stage or the stage 4 or metastatic disease.
And doctor, once the stage of the cancer has been determined, what is the line of treatment available?
So once the staging is done, the best treatment that is available should be determined by a multidisciplinary team. So multidisciplinary team consists of a surgical oncologist, a medical oncologist, a radiation oncologist and a medical gastroenterologist. All these 4 doctors should discuss among themselves and they should determine the best treatment that is available for that particular patient for that particular stage of disease. So in general, for colon cancer, for stage 1, 2 and 3, for the localized and also the locally advanced cancers, the first treatment that is offered is surgery. The involved portion of the colon is cut and removed along with the lymph nodes. It is followed by chemotherapy depending upon the pathology report. The tumor which is removed is sent for the testing, further testing. So depending upon the test report, depending upon the pathology report, further decision to give chemotherapy or not is decided. In case of rectal cancer, for localized disease, again the first treatment that is offered is surgery. So after surgery, a decision to give chemotherapy or not is decided upon the pathology report. For locally advanced cancers, for stage 2 and 3 in case of rectal cancer, the initial best treatment will be to offer a chemotherapy and radiation, a combination of chemotherapy and radiation to shrink the size of the tumor. So after that tumor is shrunk to a particular size, a surgery is offered then. Further treatment again is dependent upon the pathology report whether to give chemotherapy or not. For stage 4 cancers in both colon and rectum, many of these patients cannot be cured of cancer. So these patients usually benefit by receiving chemotherapy with or without targeted therapy, also known as the immunotherapy.
Okay. And doctor, when you say surgery, what kind of surgery is available for colorectal cancer?
So for colon, the involved portion, the portion of colon that is involved by the tumor is cut and removed along with the remaining lymph nodes. So the cut ends of the colon are then sutured together, stitched together. So this is the usual treatment for colon cancer. In case of rectal cancer, the treatment is decided upon the distance of the tumor from the anal canal. So suppose there is a tumor which is involving the anal canal or which is close to the anal canal, then the rectum along with the anal canal should be removed completely. Then the anal canal opening is closed permanently. So the cut end of this colon after that is brought out through the skin as a permanent stoma, wherein that colon contents empty into a bag. This is called a stoma and it will be permanent for that patient. So in case of tumors which are away from the anal canal, we will be able to save the anal canal along with a portion of the rectum. So in which case only the involved portion of the rectum is removed and the colon is sutured together along with the remaining portion of the rectum. So in these cases, sometimes a diversion stoma is done, as in a portion of bowel is brought out temporarily to divert the stools away from this suture line to facilitate healing of this suture line. So this will be a temporary stoma. So usually this temporary stoma is then closed after a period of 1.5 to 3 months or after completion of the chemotherapy.
Okay. So doctor, when a patient undergoes this surgery, will that patient be able to lead a normal life after this?
So after completion of treatment in these patients with colorectal cancer, so completion of surgery, chemotherapy and radiotherapy, almost all these patients can lead a normal life. The main concern among the patients, the main concern, the main resistance that we face as a physician is the reluctance to accept the stoma. So there is a sense of fear, there is a sense of embarrassment, and there is a social stigma around a stoma, which prevents many of these patients to undergo surgery. So, but once the patient learns how to manage the stoma bag, they can lead a normal life, and nobody will be able to tell that certain person is living with a stoma. So the other common problem that we face is increased stool frequency or loose stools, or sometimes even incontinence immediately after the surgery. This is usually transient, and the body usually accustoms to these problems over a period of time, and the patient can lead a normal life after surgery.
Okay. And doctor, earlier you mentioned about laparoscopic surgery. So doctor, can this be used for colorectal cancer?
Yes. Laparoscopic surgery or minimally invasive surgery is a keyhole surgery, so where a button-sized cuts are made in the abdomen, and the entire the before mentioned all the surgery is done through specialized instrument through the small holes. In colon and rectal cancer, this laparoscopic surgery is proven to have a lesser blood loss, smaller scars, earlier recovery, and earlier discharge from the hospital. Having said that, this laparoscopic surgery should be performed at centers well equipped to perform these procedures.
Okay. And doctor, apart from surgery, are there any alternative treatments available?
There are recent reports which say that the early stages of rectal cancer can be cured with only chemotherapy and radiation alone. But it is still yet to be seen whether it is applicable for all the diseases, all the stages of diseases and all the patients. Currently, the best treatment is surgery to remove the tumor from the body of the patient.
Okay. And doctor, what will be the survival after the surgery?
So for colon and rectal cancer, the survival depends entirely upon the stage of the disease. For stage 1 disease, the probability that a person will survive for 5 years or more is 85 to 90% after completion of the treatment. For stage 2 and stage 3, a locally advanced cancers, the 5-year survival drops down to 60 to 70%. And for stage 4 disease, many of these patients will not be cured of cancer. And the probability that a person with stage 4 cancer will survive to 5 years is only 10 to 15%.
So doctor, is there any way wherein one can prevent cancer?
So there are not many proven ways of preventing a cancer. So having said that, it is only logical to have a healthy lifestyle, to avoid smoking, to avoid excessive drinking, to keep drinking in moderation, and to have a healthy lifestyle in the form of exercises, and to lose weight and maintain a healthy body weight.
Okay. And doctor, also after a patient diagnosed with colorectal surgery has undergone the surgery and is treated, how often shall he or she go for checkups or follow-ups with the doctors?
Yes. So whenever we call a disease as cancer, it means it has a tendency to come back. There is always a risk that the cancer can come back. So this risk is almost always high during the first 2 years after the completion of treatment. So for the first initial 2 years, we call the patient for every 3 months for clinical examination, for tumor markers, and if necessary, CT scan or colonoscopy. And after 2 years, the risk of cancer decreases. So once in every 6 months, we call the patient for a checkup. Okay. So after completion of 5 years, it is almost equivalent to that of the normal population, though it never reaches to that level. So once in a year, we call them for checkup. Every year in India, around 8 to 11 lakh people are newly diagnosed with cancer. Mm-hmm. So most of these cancer are diagnosed either at a locally advanced or in a stage 4 metastatic disease. This is mainly because of the lack of awareness among the common public. So once that awareness is done, once they know that these are the symptoms to look for. So when some symptoms happen, to go and get a test done immediately. So that will be life-saving. If the public awareness increases about these type of cancers, the lives of so many people can be saved. Tens of thousands can be saved every year.
Okay. So doctor, now that you mentioned about these, we have spoken about symptoms, of course, but is there anything, a warning sign, maybe a warning bell, something particular wherein you would tell your audiences that if you experience so and so, you should visit your doctor, get yourself checked? Is there anything very specific?
Yes, so whenever you find blood in your stools, it is mandatory to get it checked. More often than not, it is because of a common benign condition such as a piles or a fissure. But there are some group of patients where the colorectal cancer can present with piles or a fissure. So it is prudent in these patients to get a checkup from a qualified doctor and to check for undergo a colonoscopy and see whether there is cancer or not.
Okay. Thank you so much, doctor. I really hope that our audiences take these signs and hopefully it saves someone's life.
Thank you for hosting me.
Thank you, doctor. Thank you so much. If any of you wish to consult Dr. Sredharan, he is available at Manipal hospitals from Mondays to Saturdays from 9 till 4:30. Thank you.